Hey everybody, I'm here with Dina. Dina has a clinic with, you should know Debbie. Debbie and Dina from Stewart, and we're here to do part 2, okay? So we talked about her situation, and do you want to maybe give them a little highlight? And what I'm gonna do is I'm gonna go in and use my elbow, because when you use your hands, you can't feel things. And there's nobody that works, they'll say, oh yes, that's not true, but it is true. You can't get rid of scar tissue and restore the life flow back into scar tissue and make it connective tissue. If I could have, I would have. The reality is the elbow does it. And by using a 45-degree angle coming across scar tissue, remember, when we have connective tissue, every fiber allows lymph, blood flow, okay, oxygen in, nutrients in, and toxins out. But the most important thing is spirit energy. Nobody wants to talk about that. I just love this part. The medical system only uses their equipment to test your energy levels and the actual level of your spirit energy. But meanwhile, they don't believe in anything like that.
For healing.
So, you know, it's an oxymoron, and somewhere there's a moron. Okay, now, so
We are.
we believe in what they say, but it's not true. We are energy, medicine, electrical, magnetic people. So the reality is to get rid of any, whether it's scar tissue in a joint or in an organ or in any other tissue, okay, remember something. We start off with beautiful connective tissue. Every time that you dump adrenaline, cortisol, histamine, it's very acidic. How many people know that after 3 minutes of dumping any type of adrenaline or cortisol or histamine, you're actually making very sticky, glicky fluid in the body from those hormones? They become like super glue. They take the fibers, and when you contract, because when you're in fight or flight, you contract, don't you? 70% of your energy from your core goes into your arms and legs. That's why you cannot sit down and eat a meal without it rotting if you're not sitting down with calm and peace and love in your heart. Now, so when you stress out, you contract, right? So when you also stress out, you dump adrenaline and histamines and cortisol, and guess what? Even if you're not running, you still dump it. Most people today are watching things and reading things and hearing things that are actually, stressing them out, even if they're just sitting there. So the reality is, if you dump the adrenaline and you actually were running from a real tiger, guess what? You do no harm to the body. But because hardly everybody's triggering that adrenaline rush up to 120 times a day right now. Did you know that? So 120 times a day. That's what the majority of the population is doing. That's how often they're triggering adrenaline. That's when they go, I went to the doctor and he said my adrenals are low. No, you keep on pushing the button for adrenaline, okay, for the rush. And you're getting off on the wrong hormones. It should be dopamine, oxytocin, serotonin, and endorphins, not adrenaline. Because that's why your adrenals are low, and it's because you've got anxiety and you retell the same story over and over again. But let's go to this. So your fibers are nice and they're apart, okay? That's like we're made out of atoms and no atoms touch. Wait a minute, that's not true. They have to touch because we're solid. No, we're not solid. We just seem to be solid. Atoms don't touch. They are not even touching each other, but we seem solid. Now, here's the deal. Those fibers, because of dumping adrenaline and cortisol and histamine, they're very sticky. Those hormones are very sticky. That's the glue, the super glue. And then you contract, right? Gotta run, gotta be ready. Okay? So now the fibers are gonna contract too, and you're gonna come together. And then because you keep on dumping these chemicals, and when you're stressed out, do you drink enough water? Do you eat properly? When's the last time you were stressed out? Oh, I think I'll make a salad. Okay, so the reality is now you got dehydration. So now the fibers came together, now dehydration. And now you go, I've got a knot in my neck. I got a knot in my pelvis called a fibroid. I've got a knot in my breast called a fibroid, okay? Or I've got arthritis, which is actually scar tissue issue in your joint. So we can, once we get the fibers apart, no matter if it's in the joint, in a muscle, or in an organ, we've got flow back. We don't have dis-ease. Dis-ease is when the tissues are not in harmony and balance. And remember something, you cannot have swelling, you cannot have pain, okay? You cannot have stiffness if, guess what? If you didn't have a block. The pain is actually caused because the water, when the waves come in, if I had a wall, it would still smash up against the wall, wouldn't it? Okay, so your energy flow, which is the invisible and the physical, so the blood, the lymph, and the invisible energy, the most important parts, it has trouble getting through dehydrated tissues, which are called scar tissue or calcified tissue or crystallized tissue. The energy doesn't flow as well, and the actual pressure or pain you're feeling is you have blocked your own energy flow. Let go. Go with the flow. Well, it's true. Go with the flow. Flow is everything. Perfect circulation, perfect health. When you don't have perfect circulation and somewhere in the body, you've got a physical block called scar tissue calcification or crystallization. That's it. How many body workers work with that? Hardly anybody. So this is why you guys have the Holy Grail. You'll go out there after just taking the non-surgical course for 12 days and you will kick. But, I mean, you'll have practitioners that have went to school for 4 years that will not be happy with you. Okay? Stay humble. Just explain what you're doing and stay with it. And guess what? You don't need anybody's respect because you'll gain the respect of every client that you're offering a money back guarantee on the first treatment that you'll do more than all the other treatments combined from all the other body workers. Is that enough? And I back it up. I back you up. So understand that. It's always been about that. And isn't it kind of funny? In the world of body working, nobody looks at this. But think about it. There are tens of thousands of body workers, and guess what? Nobody's getting better. Nobody's getting better from a limp to a cane to a walker to a wheelchair, okay, to hospice. I mean, seriously. Yeah, and then there's a whole, you're right, there's a whole row of diapers now called Depends. There's a whole row in Costco. There's a whole row. Don't worry, they've got them for all sizes, okay? So see, you know what? It's like this. It's all coming back. You know, I came in wearing a diaper, I'm going out wearing a diaper. Okay?
Not.
Okay, all right. So what we're going to do here, everybody, is we'll make it short and sweet.
Yes.
I'm going to go in here and I'm just going to use my elbow because people don't believe it, but your hands are numbed out. With my elbow, I can feel the smallest crystal. I can feel when there's something going to grow, like a fibroid, okay, before it even is detected. You can feel the roots coming off a fibroid because that's what they're called feeders. And what we do, even if it's a tumor, we'll go in and we won't go and upset an angry old beast of a tumor on the first time, but we'll come in and we'll look for the legs that come off of it to feed it, and we'll go in and cripple the legs because there's a lot of anger, which is inflammation, and we have to make sure that we're going in gentle because you can go in. If you were angry already and I came in and I decided to poke at you, what would happen? We'd eat my head off, wouldn't you? So I got to go in and pretend I'm your friend, and then I've got to go in and work gentle baby steps. You can work on everything from calcification to a fibroid to what I call a tumor is when it's highly activated, okay? And you can do it. You just want to be really gentle. You guys have seen me work on people where we've gone really deep. You have to take a look at a person's personality and then decide, okay, This person here is saying, please go in and deal with this. I'm going to connect to my breath. You can go in and take the scar tissue apart. This person says, I've been running away from pain all my life and I'm sensitive. I'm going to have to go in and I'm going to have to, yes, hi, Tim. We all know you're here. Okay. And I'm going to go in and I'm going to lightly just come in with my elbow and say, I love you. And then, oh, okay, and not another terrorist, not somebody who said they love me and they're going to hurt me again. So, believe it or not, most of these people that believe that they're always getting hurt, they end up with what? Environmental illness. They're allergic to life. Whether, if you don't believe me that the emotional and the electrical supersede the physical, then we've got trouble. You're probably in the wrong class. Then you're coming from a class that believes you got to cut out the tumor. You're coming from a position that you believe you got to do drugs to numb out your pain. When guess what? How many people know that they study the brain to make the drug, because the brain makes every drug that they've ever come up with, except your brain makes the drugs to actually heal you. They make the drugs to dumb you down, and so to lose your connection. Like if you take a drug, what happens is the fire's still raging inside, but you don't feel it anymore because it cut off the gut-brain connection. Yeah. And the reality is, that's why you go from drugs to surgery, because the fire was still raging. And if I put my hip on a barbecue, even on low, it'll become a piece of beef jerky. And that's why people have to get hip surgery, spine surgery, knee surgery, or get rid of the fibroid here or there, because they barbecued themselves on an emotional level and a physical level. Emotionally, they were stressing themselves out, dumping adrenaline and cortisol, which is highly acidic, which causes inflammation. And then every toxic processed plastic food or bottled water that you think you're drinking great stuff, you're actually not hydrating, but you're even causing more trouble. Okay,
Should she tell her story real quick?
Yeah, tell your story.
Just real quick, I found a
No, not too quick.
Well, okay. I found a lump.
Everything has to be quick, eh?
You're right.
The two of you, the quickies, the quick girls.
The captain and the warrior. I found a lump on my left side, the size of a marble. I said, okay, well, we'll get it checked. And just to know, the stage of inflammation. That's it, just what it is with inflammation. Bottom line, they call me, ultrasound. After an ultrasound, doctor calls me and she says, well, they recommend a biopsy. I said, no, not doing that. No, you're gonna follow my lead. I said, I'm not cutting, burning, poisoning. I just want to go the way I know to go. I am informed, I know what to do. We have a cell-sonic machine, we have the Wolf non-surgical method. I have all the nutraceutical. I'm gonna, upload, front end load. That means, taking more of my high nutraceuticals, because as you raise your vibration, no matter what that is, it's gonna go away.
You rewrite the story.
Right, so with the help of my partner, Debbie, worked on the non-surgical, the cell-sonic. I clapped the area. I'd rub it with Ocean's Essential Orange, and I would do the whole, breast work and clapping under the...
Are you doing any DMSO on it?
Yes, we are. The DMSO. We're doing all that we know, all that we were taught.
And use frankincense. Like alternate from orange essential oil to frankincense.
Okay.
Because frankincense is really good, but frankincense is about 100-time concentrate. It's the highest concentration of frankincense you can get. So if you go from orange to frankincense or frankincense, you want to alternate. Why?
It's another frequency.
I'm over here. No, I'm over here. I'm over here. No, I'm over here. Okay? Let's make it complicated for the cells, right, to get used to anything.
And on the first...
cream or the gel?
You use the gel, and then if you start to dry out there, you can go to the cream. but you want to keep hitting it with that because it's a solvent and it carries in everything so much deeper, and it really can help the fibrous tissue to go into more beautiful connective tissue. Because look at DMSO is made from pine trees. It's not toxic. Now, because it carries things into the body, they're so concerned, they are so concerned that you would like put DMSO on you and then you would put poison on top to carry it into your body. So if you put DMSO on and then you use things like essential oils or any other nutraceuticals that are healing, it's going to just increase the healing. Right?
Suck it in.
Yeah. So the DMSO is a solvent. It goes in and it opens everything up.
Kind of like a traveling agent.
Well, it is, but it also increases circulation. Really unbelievable. So when people use DMSO and they use pain away essential oil and they use clapping, they can see amazing differences in one treatment on themselves by just doing their own thing. But
And we have the ability to reject everything that's handed over to us. A diagnosis, I rejected right away, and I didn't want her to elaborate because no, you're not feeding that into my mind, number one. I knew the power of the mind. The mind can hurt you, but it can also heal you. So I knew, and I stopped them from talking and going beyond the description, except she really wanted to put a word in and she asked permission. Can I tell you what they said? Go ahead. Suggestive malignancy. Who suggests malignancy? It's either you have it or you don't. So when I brought it, I said, can you be suggestively pregnant? She goes, no, I get it. And she's I like her mind too, the doctor. She says, okay, I'm going to roll with you. I'm going to support you in your decision of not doing any of that.
And do you know why she's going to roll with her? Because she said, if you're not going to roll with me, I'll roll on my own.
That's right. That's right. And I said that.
And guess what? And that wasn't a threat. She just says, give me high vibration or give me nothing.
Yeah.
And doctors will try to get their threat out first.
Yeah.
If you don't do what I say, I'm going to quit working with you. Now, but guess what? If you don't do what I say, I'm going to quit working with you. Yeah. And I'm not telling people to come up against their doctors. That's not what I said. So don't misread this.
I knew she was open-minded to that. She's read a lot of my information. She was going to come to one of your lectures, and she went to Israel. She had to go see the grandbaby, but she was signed up for one of the lectures. So I know she was open-minded, and I said, I'm going to go my way, and I would like you to support me in that decision to continue to work with Debbie, the nutraceuticals, and the Cellsonic. And she has all that information. She can read all about herself. She's open to knowing more. So now we are here today. I have the opportunity to come and visit you in Bonita Springs, and Doc is here, and he's going to share what he would do in my situation. If there's more to do, we're going to continue that way of doing things together. We're going to take another x-ray or whatever we need to do in about another, month, 6 weeks, thermography and the ultrasound, and we're going to have an update on that. And I know it's going to be gone because on the first treatment, the marble was already flattening. And each time, now it travels, and it wants to come back together. I said, Debbie, the sucker wants to come back together. So let's go. So we went hard at first, Doc, because we didn't know was it going to open gently, lovingly. We went harder. Now we'd hold it and I said, go! Go! That's my terrorist side, okay? That's the girl driving like a maniac. Just calm down now.
So let's spill all the anger out that's in this ball and find out.
Like that.
Just I'm exaggerating because I have a tendency.
They have a video where her breast actually went.
So we're here to expand our knowledge with Doc and continue the treatment so we don't get poked, cut, burned. And the average person by now wouldn't have any more breasts. They'd be out. Cut them open, just take them out. I did not allow no. That's my body part. It's nothing.
But let's be fair. People don't know that they're running self-hate programs, right?
Right.
Let's get rid of the parts of the body that hate me. No, your body doesn't hate you. These are, even growing a fibroid is a protective thing for you because it's storing toxins, and it could have been a lot worse, but it's trying to concentrate it and put it in there. So we want to gently just take it apart gently and go, okay, guess what? Help is on its way. Not, let's blow the sucker up.
Right. And listen, they're so expensive, there's no way they're coming out. Mr. joke, you know. It's true. No, but it's like I knew that I'm not getting body parts cut on me. Not going to. Not going to. We have a better method. We know better. When you know better, you do better.
Okay, let's do better.
Okay. This
Okay.
way?
Yeah, I'll have you lay down this way and I'll be on this side.
Okay.
Okay. Debbie, can you move that so we can see right here? Just bring it down. Oh, no, do you know how to do it? Nope. Okay, you want me to? I should come and do it probably.
Just
No.
bring the
This
phone
way.
down.
No. Okay.
Nope.
Here, let me do it. Okay. Okay. You see right here? Okay, right here. This.
Okay.
No, it's actually this one, actually. Here. See this? Oh, hold on. There. Okay. All right. Okay. All right. So this one, right?
Yeah.
Okay. And have you put your arm to the side. Okay. Bingo. There it is right there. Okay. So we found it. Now, how am I going to break it up? I can't. So when I go in here, I'm going to pull taut. And then I'm going to go in with my elbow. If I pull this tighter, you can feel everything. Okay. So let's get somebody who won't lie. Who's not a liar here?
Debbie.
Liar.
No, you can't. You've been working on it. I want you to feel it. I was just kidding. I was kidding about the liar thing. Okay, I want you to feel it. Just feel it. You feel it? Feel the nodule? No. You've got to close your eyes. First of all, you want to be a good therapist? You're out of your mind and blind. No, you're too hard. Relax. The soft.
Nothing hurts me, so, you know, just.
Feel it? You see? So what she was doing is pushing hard and overshooting it. You guys, you come in gentle when you learn the non-surgical. Come in gentle. And you will feel the most amazing things. Okay, so you feel that? Okay. Now put that in your mind, and then I'm going to come you back and feel it when I get done here. So when you work on something like this, you see the movement? It's not aggressive. Okay? I want to find the weak points. I'm going so gentle. So, yeah, so here it is. And guess what this is? Does anybody know that this is actually exactly where it is in the breast? It's actually a child. This growth is caused because of a child problem. Okay? And she never told me that. I'm telling you that. If you go and watch the emotional chemistry of cancer, disease, and healing, you'll understand why. I mean, we are just been so dumbed down that we actually believe that when there's a growth somewhere in the body that it hasn't got something to do with something. Think about how dumbed down we are. We could be totally intelligent, high vibrational. Now, does anybody know that this is more of an emotional release than a physical one?
Yeah.
Okay, but guess what? We just don't do that, do we? Buck up, be brave, swallow it. Okay. Now remember, I've worked on this for what, 3 minutes? 4 minutes, maybe?
It feels released.
Yeah, it is. I've already released it.
I feel it.
Okay. So if I went in here for 5 to 10 times, and then I did the cell sonic, it's gone. Because you have to create a new program. I'm going to explain that when we're done here. But I'm going to have you come back and feel this. And remember something, I've only worked on it for how long? So, you know, don't give me your BS medical breakthrough stuff, okay? Show me a medical breakthrough that didn't end up as a medical breakdown. Okay? And I'm not trying to pick on them. I'm trying to tell them that, you know what, they're good for emergency situations, which is 1 out of 100 people that come into the hospital. Wait till you see this. Okay, now, remember. Okay, go feel it now.
I want you to feel it too, because you know it.
Yeah, there isn't that
Well, there's no
all
lump.
over.
That's right. So we've taken it down about, what do you think, 60? So now I can keep going, but if I'm going to keep going, I need her to take her top off.
We could do
It's
it
hard.
off camera and
It's
offline.
hard working on her with her top because I have to work through this. It's easier. I can feel okay because I'm telling you guys, whether you want to believe this or not,
Oh my God, it's like night and day.
I'm feeling the finest little threads of fibrosis. And we can take every thread of fibrosis apart. If I had a half an hour to go in there for half an hour, 40 minutes, okay, we will get rid of 80 to 90% of it. And then what we're going to do is come back in again in 5 days because we did not cause any bruising. And you don't cause bruising when you go really gentle, but sometimes you don't ever want to bruise here. But I could work right here, depending how toxic that lump is, and there's going to be a bruise anyways. Because guess what? Rotten fruit bruises easy. Rotten tissue bruises without touching it. It's already bruised. It's toxic. Remember something, healthy people don't bruise. Okay. Okay, so guess what? Here it's flat. Here, this popped up. Right here.
One of the legs.
Yeah, popped up right here. See? So, you know, you'd be surprised what's going to pop up. So what I would do, when did you do cell sonic last?
Today,
Okay.
just now, before you.
Yeah, guess what? Feel it now, just from that
I
little
know.
bit. See, that little one's gone almost. Just from that was only 20 seconds, 30 seconds.
Oh, yeah.
I'll tell you something right now. If it was me, I'd go in and do cell sonic right now. Come back here in a couple minutes, and guess what? If you want to feel this, the cell sonic's even going to bring it down more, then I can even go deeper. Because now we're using my energy plus the 25,000 volts put into a field, right?
So let's do it.
Now, what you always want to do when you work with people, if those of you who end up getting them, cell sonics, you go in with a 10, you work on it, and then you finish the area off with a 4 or a 6. The 10 goes in, and it brings enough electrical energy to help bring things apart. And then you do your work, and then what you do is you go in with the 4 or the 6 because that energy will stay in the breast for 48 hours. So it's helping just, okay, no, you're not going back to the old pattern, okay, because I already told you this area here has got something to do with a child. It does. It's got something to do with a child. And the reality is we've got to get these tissues, because what happens here is first, she repeated that program over and over again. Once her subconscious accepts it as a prominent, dominant thought, so does every cell in the body. And if it's a negative thought that has dis-ease attached to it, it will go to the area and store it because it could cause death. Or severe illness. It's better to have a storage, and the storage is called a lump or a bump. Are you with me? Yeah. All right. So even a pimple is a storage of pus. A cyst is a storage of dead cells and pus. Would you rather the ovarian cancer, the uterine cancer, or the cyst? Do you understand? So we have to have a storage until the host wakes up, until the host brings their vibration up. So understand, you may not like certain things that are going on with your body, but understand your body is trying to work with you and say, okay, this program's got to stop. But until it does stop, we have to store all this negativity that becomes physical, okay? And that's why the bump is growing. That's why it's harder. Because we have to calcify it so it doesn't spread out. We got to create a calcium wall. It's scar tissue because we're trying to create a moat around it so it doesn't spread throughout the body. So the more anger, the more hate. And I'm telling you right now, cancer is an anger-hate thing. I hate my life. I hate myself. I hate the world. I hate something. I'm so angry. You take a lot of anger and hate, you're going to get a big ball of mess, aren't you? Listen, people that have unconditional self-love for themselves do not die of cancer or heart disease. All right? And people that get enough love, okay, aren't diabetics. Because diabetics are people that don't have enough sweetness in their life and they make sure they get it one way or the other. If it's not in the invisible realm, it's in the physical realm of 10 pounds of sugar. Yeah.
Oops. My cashmere song.
Okay. All right. So go do it.
Okay.
Go do it and then
if
come
we-
back.
And if we turn it off, I'll take the shirt off. I don't care. I want you to go get it.
Okay. All right. Let me just.
Class, right? Yeah, just. It's not, yeah. Just
So before Dina goes, okay. All right. Before Dina goes, after we work, she'll go get Cellsonic now. She'll come back. I'll work on her, but I will be working skin to skin. Okay? All right?
How many pulses?
You don't need a lot. 150 around the area? Just right around the area. That's it. Huh?
On the 6th, so we did 10 all the way.
That's it.
6.
6.
Thank you.
And then guess what? Then I'll let you feel it.
Yeah,
When they, as soon as they come in, you can feel it again. Then I'll go in and work skin to skin and then see what we got. Okay? I'll have her come on and she'll just say, you know, however she feels at the end, and we'll have our beautiful taste tester over here. Okay. Thank you.